Thank you very much, Kieran. I think that paves the way very nicely for Dr. Gina Radford, who we're very honoured to have here, who's our Deputy Chief Medical Officer. She was appointed in January of this year and has quite a task ahead of her. So she's come to tell us what to do, I think.
Thank you very much, and thank you very much for your welcome. I love coming to conferences like this, particularly conferences where I don't necessarily know the depths of the specialty and the topic, because I always learn something new. And the thing amongst many that I've learned today is about jumping genes. I had never known that there were such things as jumping genes, so now I know that. As Ken said, when I was on the way here, the train broke down in a tunnel for 10 minutes. And after that, the driver came on to say, "Don't worry, I've fixed it." And off we went. I have no idea what he did, whether he wiggled a knob or kicked the train, I have no idea. If it had been a plane, I think I would have been a bit more concerned. But what I want to try, and I hope you are gathering from the presentations you've heard, is to get over the message that a little bit of tweaking here and there is not going to fix this problem we're talking about at the moment. This is a real international, global emergency that we're dealing with. It's one of the biggest risks globally that we are facing. So that's what we're talking about. That's the scale of the problem. And what I hope when you leave this morning, I'm not going to give you a particularly cerebral presentation. I'm neither a microbiologist nor am I a urologist, so I'm not giving you a hugely cerebral one, but I do hope that what you walk away is thinking, well, therefore, what can I do? And maybe one or two ideas. Because actually, it's all of our problems, whether we are patients, whether we are clinicians. We all share in the responsibility for this really very dramatic challenge that we're facing. So thank you for asking me to speak, and Dame Sally herself would have very much liked to have been here because she is very, very passionate about this issue, as you'll be well aware. But actually she's just been in the States talking about just this, so she does apologise. Right. There we go. So as you know, the consequences of antibiotic resistance, as we've been hearing, include increasing treatment and failure around some of the common infections that we'd have to treat, such as UTIs, as you've just been hearing about so eloquently. And also it makes things like cancer treatments for our older patients even riskier, as they're more vulnerable to infections. And it's because of modern medicine's increasing dependence on antibiotics and the need to avoid entering the horrendous concept of a post-antibiotic era that the CMO has championed the need for action on this very topic. Now, her interest really started with the publication of her annual report back in March 2013. She actually started the work 2 years previously. And Mike Sharland, who was due to speak to us this morning, was actually one of her advisors on the report. Within this report, she had a whole chapter beginning to map out the stark challenges we have ahead of us if we are to tackle this problem. So we're now looking to find other clinicians, yourselves, to continue championing the challenge to deal with antimicrobial resistance. As you've also been hearing, in response to that, a government produced a 5-year AMR strategy in September of 2013. But this wasn't the first strategy. We had published a strategy back in 2000 for those who can remember that. And as you can see, although it had much success, particularly, for example, in helping to drive down rates of MRSA and various other things, we've still got a long way to go. And things are not improving as fast as we would like them to. This particular strategy is very much a cross-Whitehall, interdepartmental, multidisciplinary strategy and involves Department of Health, Public Health England, NHSE and DEFRA, very importantly, because clearly animal husbandry and the whole concept of One Health is extremely important in this whole area of AMR. The aims of the strategy are set out, and in essence, the aims of the strategy are very simple. They're to prevent people from being infected, preserve the antibiotics that we do have so that we can use them to maximum effect when we need to use them, and to promote the development of new antimicrobials and new approaches, as well as better diagnostics, so we can only use antibiotics when they are actually needed. And all this is underpinned by the importance of surveillance, so we naturally know what the heck's going on in terms of antibiotic resistance, prescribing, etc. Research and development, so we're able to stimulate the pharma and other companies to produce new antibiotics and other mechanisms to tackle AMR and to tackle infection. This whole concept of a One Health approach, where the importance of looking at health issues and AMR from a paradigm of the interests of both human health, animal health, and the safety of our environment. And then also the importance of international collaboration. Because as we've been hearing, this is not our problem, it's an international problem. And some of the issues we are having to deal with in terms of some of the real challenges in terms of resistance are coming from elsewhere. We need that international collaboration. So we have a very wide-ranging programme in place, both nationally and internationally. And our progress to date and future plans are described in a progress report that was published in 2014. And as I've said, AMR is global. And the UK is now a major player globally. For example, we've managed to help gain international support for a WHO Global Action Plan very recently. And our message, both globally but also nationally, is exactly the same. We need better infection control and infection prevention. We need to conserve the antibiotics we do have, and we need a sustainable supply of suitable diagnostics and new treatments. So we've got a large domestic agenda if we're really going to tackle this seriously, and we need your help to take this forward. As our colleagues who've just been speaking know, the Chief Medical Officer recently convened a meeting of leaders from various specialties to discuss this very issue and how we can move forward together, shared, our issue, our solution. And after discussing the work in progress, we sought views as to how best to engage clinical leaders and their constituencies. And that meeting agreed, firstly, that yes, AMR is everybody's business, and all professional groups, including this one, need to play their role in this improving practice and addressing this challenge. There was agreement that it is entirely proper and appropriate for clinicians to challenge not just their own practice, but that of their colleagues as prescribers, and to debate to improve how our practice is undertaken. And I'll be very interested to hear, either now and in the weeks and months to come, what is actually happening in terms of your own discussions, debates, both as a society, but also within your trusts. What are the examples that you're beginning to highlight? And also, where are the issues that you would find having more data helpful? And how can organisations like this help in supporting you locally in your own work? Now, I understand, and we've been hearing something about this, that there's already discussion amongst your profession on the need for routine prophylaxis. And this is very welcome. And some other examples of action that you may wish to consider are highlighted here. These are just ideas, and we're always welcome to new suggestions from you as to what you may be considering, and also, as I said, what you may find useful and helpful in terms of support either from the society or from ourselves. Now, these actions are ones that we hope that can be taken forward both by individuals to improve your own local practice, by your clinical teams, your multidisciplinary teams within your own trust, and also by BAUS. We all have a role to play. And I, the Department of Health and Public Health England, will be interested, as I said, in providing whatever support we can and hearing about examples of good practice that we can share more widely. Intraprofessional action among urologists is important, but so is engaging with other professionals and other disciplines. For example, we've been hearing from microbiology earlier, and the importance of engaging with those who have expertise in infection prevention and control within your own trusts, because these are individuals who can advise on treatment decisions and involve you and your teams in antimicrobial stewardship. And a multi-professional approach is essential if we're really going to contain AMR. But we need champions within the different professions to really champion AMR within your work and within your trusts. As we have heard, there's very significant variation in levels of prescribing. And we believe that prescribing can be safely reduced, just as we've heard earlier, to help tackle this problem. Now, urologists have a very good track record in innovation. For example, with rapid adoption of keyhole surgery, you were some of the pioneers and leaders. And I hope and I know that you'll apply the same proactive approach to working with us all on beating AMR. We've published national antimicrobial prescribing quality measures that try and reduce total antibiotic prescribing and encourage the use of narrow spectrum antibiotics in both primary and secondary care, because our aim is to ensure appropriate prescribing where patients receive the right drug at the right time, the right dose, the right duration, and when it's clinically right. However, an important point in all of this is that we also need to check out whether there are any unintended consequences of these challenges in prescribing. We've been hearing earlier that whilst there is good evidence in some areas, in others the evidence isn't so good. And you and your patients need to be assured that changes in prescribing are beneficial and do not have adverse patient outcomes. And this may be an area that BAUS as a society can take a lead on, and we would be interested in hearing about that and your own experience. Another and important area that CMO meeting agreed was the importance of the role of education and training, and that antimicrobial stewardship should be included in clinical curricula. And I very much hope that BAUS can play an important role in promoting this. ARHAI and PHE have developed multi-professional antimicrobial prescribing competencies, which you may, as a society and as individuals, find helpful. So we all have a role in increasing awareness of AMR and taking action to combat it. But one very simple step that we can all take is to sign up to PHE, Public Health England's campaign to become an antibiotic guardian. Now, this only takes a few minutes online, and pledges are available for prescribers, the public, students, and other groups, so you can promote this to your friends and colleagues. The whole idea of this campaign is to ask everyone to help cut the use of unnecessary antibiotics by choosing one simple pledge about how they, how you, how I will make better use of antibiotics and help save these vital medications from becoming obsolete. Antibiotic Guardians were developed for the National European Antibiotic Awareness Day, which is held on the 18th of November. And that's another way to focus interest in AMR. And a range of educational materials are there to support you, whether it be in your local trust, with your local teams, or even as a society. So in summary, and here is some further information for you if you are interested, but in summary, I hope that you will, as a result of having heard these discussions and in your own in the various presentations you have heard to date, that you'll consider how to audit and improve your own practice, both individually as teams and nationally through BAUS. That you'll look to work with colleagues across disciplines to improve prescribing in your own trusts and your teams. That you'll think about how to raise awareness of AMR with your colleagues and with your patients, perhaps by using the opportunity that the annual European Antibiotic Awareness Day in November offers. And also think about signing up and becoming an antibiotic guardian and joining this important campaign to address AMR. So thank you very much for listening, and I'll be very interested to hear, both from your own local but also ideas from BAUS as to how together we can address this challenge. So thank you very much for listening.
Well, that's a great rallying call for us to end on. I'm very grateful to the speakers for putting this together. I think this has been a very educational. I've learnt a lot during this session, and I hope it's pertinent to all of your practices. I will finish now, and a round of applause, please, just to thank the speakers again.